If someone's got a weakness to one side, if the muscles of the trunk on one side of your body have been affected, it's going to be difficult for you to maintain sitting balance if one side's weaker than the other, isn't it? You see people start to slump to one side. So it's really important that you have good supportive seating and that you have people in a good position, because we already said earlier, didn't we, how long people spend sitting in a care home. We talked about spasticity and that you can get these problems with the hands becoming tight, but also people can get problems as well with their ankles if they're sat in a chair that's in the wrong position. All sorts of problems due to them being not sat correctly. So good positioning of the stroke is important because obviously you want people to be comfortable. You want to prevent complications, and another complication that people often have if they're not sat appropriately is that they develop pressure sores, of course. Also, if you're sat well, if you're sat in a nice upright position, you've got lots of support, there's a nice lap tray in front, your arms are free to do more activity, whereas if you're in a chair that's too wide and you're having to try and grip on and anchor yourself, or you're in a chair where you're slumping up, how can you do any activities if you're not able to sit in your chair? Also, besides activity, if someone's sat upright, it's better for feeding because of the swallowing as well, isn't it? You want to be sat upright. So we're aiming for hips, knees and ankles to be at 90 degrees. That's the optimum, that's what we're aiming for. Some points to consider when you're selecting your chair for your resident. I know often people seem to have the same chair that they like to sit in when you go to the living room, and it might not necessarily be that they're sat in the chair that's the most appropriate for them. This chair's too low for you, really, isn't it? Yes. Very low. Okay. So when I say you want people to be 90, 90, 90, we're not at 90 here, are we? So if you try to get up from that chair, you see how she has to use her arms to push herself up because she's got further for her bottom to go, because her hips are lower than her knees. So ideally, you never want someone sat with the bottom lower than the knees. You want to be slightly higher, if anything, because then you don't have so much work to do with your thighs to power you to stand up. So it takes more effort to get up if your chair's too low. Also, when you're sat there, you've got more pressure going through your sitting bones, through your bottom. Now if you sit on your hand and feel those, well, ischial tuberosities, you can feel those bony bits. All your weight is going through those bones onto that bit of skin. So you're going to get uncomfortable after a while, aren't you? And of course, some of our stroke patients can't alter their position on their own. They need you guys to come along and hoist them. This chair over here is obviously too high because your feet can't touch the floor. So your feet are dangling. Now, if you're somebody that's had a stroke, who is immobile, so you can't get up and walk around, you're sat in that chair and you're dependent on other people to get you up and move you into another chair. So your feet are going to just be hanging like that for a long period of time, so eventually people can start to get problems with contractures and things there, start to get stiff, pain around their ankles and things. It's going to be uncomfortable. There's going to be, because your legs are hanging down and they're not supported, they're not touching the floor, eventually you're going to start to get pressure problems. Rather than on your bottom, it's going to be here under your thighs, because all your weight is sort of hanging on that part. So just above the knees, under the thighs, pressure sores might start to be a problem. And sitting balance is more difficult as well, because we use our feet like anchors, don't we? They help with your balance. So you're having to use more of your trunk muscles, your core stability muscles, to keep you sat upright. So if people can't touch the floor, they're going to start, either they're going to become tired because they're using the muscles more than they need to, or they're going to try and rely on the good hand to hold them steady in the chair. So you're going to become uncomfortable in that chair as well. The depth of the chair, so that's how deep the chair is this way. If the chair is too deep, it can start to rub under your ankles. You know when you have armchairs and some have a shallow seat, and some are really deep like that. It can start to rub under your knees if it's too deep. Also, you see people start to slump, so people start to slide out of the chair, don't they? Like that. Yeah, perfect. Okay. But equally, if it's too shallow, then your thighs aren't supported properly. So if your thighs are hanging off the edge of the chair, that's going to be uncomfortable as well. how wide the chair is important as well, because you need to be able to sit comfortably, but if a chair's too wide, it's harder for you to maintain your balance. So if it is, you might want to roll up towels or blankets or something to wedge the person in. If it's too narrow, you're not going to be able to make use of the armrest properly. So there's a lot to think about, really, when you're sitting somebody in a chair. Look at the person, look at the length of the limbs. Can they get the feet flat on the floor? So feet are flat on the floor here, that's a good start. But what about the position of the knees and the hips? Have we got that 90-90-90? No, we haven't. So you might want to put a cushion underneath your bottom to raise you up a little bit. That might solve the problem. Perhaps we could put just chair raisers underneath to raise the chair. Might make it more suitable. Then we need to look at the width of the chair. So about, you have your fist clenched about that sort of distance either side. You really don't want any more than that, or it becomes too wide. So you need to be thinking about the chair that people are going to be sat in, but then also, when you're thinking about positioning people, we talked about if people are immobile, how they can start to get pressure sores and uncomfortable because they can't alter your position. If you go to, I don't know, if you go to the cinema or something and you're sat for a long period of time, I start to fidget exactly. You start to cross your legs, say, move about in the chair. But if somebody hasn't got that strength in the body to be able to relieve the weight, move about, they're sat in that one position until you guys come along and help to move them. So it's really important to get the position right when you're first putting them into the chair. It's important to think about pressure cushions. Obviously, when you're sitting someone on a pressure cushion, you want to make sure that the bottom's right at the back of the chair and that the weight's evenly distributed. So you're hoisting someone onto a chair, onto a pressure cushion, but you hoist them on and they're sat either the bottom's not at the back of the chair, then even though they're on a pressure cushion, they're still sat safely, they're still going to have problems. And if you sit them and their hips aren't square, then can you see all my weight is kind of going on that one side of my body? So you still need to make sure that you're positioning people. You might need an extra person so that one's using the hoist and one make sure that the bottom's at the back of the chair, because if they're not positioned properly, then the pressure cushion isn't going to work. If someone's not sat correctly, it's difficult to do any sort of activity, isn't it? It's difficult to feed yourself. You're going to end up with problems with contractures, muscle wasting and loss of sitting balance skills. I think the strength that they did have, they could lose it if they're not sat correctly because they're not able to use the muscles that they've got.